Um, so I'm Dr. Nicholas again. I'm going to walk us through does diet impact MS? And just to introduce a little bit of my background, I went to Miami University for undergrad, which I had the joy of going to my alumni weekend at Miami this past weekend. It's been a few years since then. And then did my medical school up at Medical College of Ohio and found my love of neurology, and then went on to University of Pittsburgh Medical Center where I did my neurology residency training, and then came back home to Columbus to do my MS fellowship at Ohio State and my master's of public health. Worked there for a while, and then joined Ohio Health, where I get to work with all these wonderful folks at the MS Center. So the topic that I'm going to be discussing today is diet and the impact that it has on MS. I would say that this is one of the most common questions that we get in clinic. There's a lot of information out there on the internet, and of course, all of it is true, right? If you only eat fruit, then you'll never get MS, or all of these wild claims. And so I think it can be really confusing when we're all trying to be healthy individuals, and especially when we're living with a chronic disease, to take in this information and figure out, what am I really supposed to do, and how am I supposed to do it? And so sometimes I come across people in my clinic who will tell me that they're doing a certain diet and spending an excessive amount of money to do it because they were told that this would actually prevent them from getting worse with their MS. And so that's why I think it's just such an important topic to talk about, because with diet, we need to make sure that we're getting a healthy diet, but also that we understand what is the science, and that we shouldn't necessarily be breaking the bank to do one diet. But what I always tell people is the diets can have a significant impact on how you feel. And we talk a lot about, treating MS, preventing getting worse, but I think one of the most important parts of MS care is managing symptoms. And what we have found in research is that certain diets can have positive impacts or negative impacts on your symptoms that you experience. So hopefully walking through some of this will help to highlight that. There's also a lot of research going on about potential immunologic effects on our immune system that it may have. But present day, there's not evidence that one diet will fight MS in isolation without disease-modifying treatment. So the first thought I want you to kind of think about is, we see that MS is more prevalent in certain areas of the world. And when we look at that geographic distribution, we know that in Western countries at northern latitudes, like the United States, it's so much higher, the incidence of MS. And then if we look at the Eastern countries at the same latitude, it's not quite the same. And so that has raised the question to researchers, epidemiologists, and scientists, why is this? Well, unfortunately in America, we get criticized for being sedentary. I think a lot of the way our world is set up, we're not necessarily in walking distance to everything that we need. So a lot of what we do is driving to work, driving to the grocery store, whereas in many other parts of the world, everything that they need is right in that community. So in countries like the United States, where we have this more sedentary lifestyle and this more energy-dense diet of these processed foods, prepackaged foods, we found that this is a major difference from these other countries where we see that there's a less prevalent onset of MS. And so one of the hypotheses that's been found from research is that when we're eating a Western diet, which is meats, sugars, packaged foods, after we eat, we call it postprandial, we see inflammatory markers go up in the blood. And so one of the questions is this driving autoimmunity? Is this driving an increased risk of MS? We know that weight is an important factor in the development of MS. So actually childhood obesity results in a significant increased risk of MS. And then furthermore, there have been studies where we look at somebody's body mass index, and we see that if it's high, if it's not in a healthy range before the age of 20, there's a 2 times increased risk of MS in that person's lifespan. So these are all just really interesting areas of research currently. So let's kind of break it down into looking at, on the left side of the screen, the vegetarian or vegan diet as compared to the Western diet. So the vegetarian or vegan diet is considered to be anti-inflammatory. And this is mainly taking in fiber as complex carbs, vegetables, fruits, heavy in fish, legumes, and certain vitamins, along with not overeating, having more of a calorie-restricted diet, and incorporating exercise. So what we see is that the bacteria in our gut are actually better, healthier bacteria, and we call this eubiosis, and results in a healthier overall profile. Now, I'm not going to get into the basics of all these funny science words that are in that box, but just to make a point that what we're talking about here is that this is pro-inflammatory, and some of the immune profiles, or I'm sorry, this is anti-inflammatory. The immune profiles that we're talking about here are what we see disrupted in multiple sclerosis. So looking at an anti-inflammatory diet that may be able to shift our immune system to a more friendly state instead of an autoimmune process where our immune cells are attacking our own nervous system. When we look at a Western diet, this is certainly, steak, potatoes, sweetened drinks, sugar, high salt. These are all the tasty things, that tempt us. And if this is primarily someone's diet, we see that this results in pro-inflammatory factors. And so some of the cytokines or signaling molecules that are occurring within the immune system are promoting inflammation, and it actually makes our gut barrier a little more permeable. And so this has been hypothesized to result in making the blood-brain barrier, or the tight barrier that prevents bad things from getting into our central nervous system, from being more permeable and allowing immune cells to slip in. And so these, again, are some of the connections that we make when we think about diet and autoimmunity or diseases like MS. So this is just an overall schematic of how we think a Western diet impacts MS. Again, we talked about all these foods: low fiber, alcohol, sedentary lifestyle, red meats, processed food leads to less bacterial diversity in our gut and a less healthy gut profile. This leads to inflammation, not only across our blood systemically, but that can actually increase blood-brain barrier permeability, which can result in inflammation in the brain and spinal cord. So this talks a little more specifically, just if you're interested, on different foods that are in a Western diet or a pro-inflammatory diet, and how these may impact different immune functions. And we think that these immune functions, interestingly, when we look at them individually, are very important in thinking about diseases like MS. So let's break it down into different components of diet. So fatty acids. We hear a lot about omega-3, polyunsaturated fatty acids. These are mostly your fish, your seeds, nuts. I think these are all really tasty things. These are good for diet. When we look at animal models of MS, we actually see that these are associated with decreased neuronal loss or neuronal degeneration. And in MS, that's something that we're trying to prevent, because we see in MS we have damage in the brain and the spinal cord, and then over time we can see dying off of those neurons. So at least in animal models, there has been shown that these can be resulting in decreased neurodegeneration. There are studies that show that people who follow this diet have a low incidence of multiple sclerosis. And they suggest that it may reduce relapses. But again, we don't have studies yet showing that it impacts progression. The Mediterranean diet, I think this is one of the most popular diets that's talked about. You can see that food pyramid there, that really this is where we're focusing on eating mostly veggies, fruits, whole grains, olive oils, beans, nuts, legumes, seeds. It is not the beef jerky that I saw over there on the table, which I said only in Ohio, right? But this diet is very heavy in olive oil. It's anti-inflammatory. And this, again, is associated with a lower risk of MS. It has been shown to decrease weight, and studies of MS can impact reduction in fatigue, disability, and improve quality of life. What about the Paleolithic diet? So you can see here that this is mostly leafy green vegetables, plant proteins, soy, and nuts. And so really here what we're trying to avoid, you can see at the bottom, we want to kind of avoid bread, sugar, milk, rice, beans, potatoes, so really no dairy or processed foods here. This has been shown in studies to reduce fatigue, which we know is the most common symptom in multiple sclerosis. But we need to be careful when we're cutting out things to make sure our care providers know what we're eating, because this potentially could set you at risk for certain vitamin deficiencies. So we just want to be aware so that that's being monitored, and certainly drinking lots of water. Another diet that's been talked about quite a bit in multiple sclerosis is the SWANK diet. And in this diet, we're really limiting saturated fats, and we're trying to increase the amount of fruits, veggies, and oils. The reason behind this diet, or why this is proposed to be a healthy diet for MS, is because if we reduce fat consumption, this may be related to protection against neuroinflammation and neurodegeneration. So again, you see on the right-hand side, veggies, pasta, grains, eggs, fish, fruits, and poultry. And then on the left-hand side, don't eat the potato chips, the red meat, or the bacon, which many of us know are quite delicious. So we'll go ahead and go to the next diet. So the McDougall diet, this is where your main calorie source is carbohydrates from plants. Here, we're restricting olive oil in animal products like eggs and dairy. Again, this diet has shown a reduction in fatigue and MS, but currently to date, we don't have any studies showing that it impacts actual disease activity, relapses, new lesions on MRI, or disability. And then when we talk about calorie restriction or intermittent fasting type diets, this has also been called the hyperbolic diet, calorie restriction. This is because we've seen that increased calories following meals results in this postprandial inflammatory state. And so if we're restricting calories, we minimize that following meals and thereby reduce inflammation. This has been shown in animal models of multiple sclerosis to reduce progression. There have also been studies in individuals with MS where you compare a standard calorie diet to a restricted calorie diet to an intermittent fasting diet, and the folks who were on the restricted calorie diet and the intermittent fasting diet felt better overall, had better quality of life, reduced fatigue, and blood samples showed reduced markers of inflammation. So this is a major area of interest. I think that there are some challenges with this because when people are tired, if they're not getting enough calories or their blood sugar drops, that can be a problem. If you're like me, I get a little hangry if I don't have food all the time. So that's a word my kids use. But it's something that, if this is something that you feel could fit in, might be helpful. And then the ketogenic diet. So this is another very popular diet. This is where you can see in this schematic here that it's about 70% fats, 25% proteins, and a very small sliver of carbohydrates. So this diet results in an increase in ketone release into the blood, and ketones release or reduce inflammation. There are studies of ketogenic diet in MS that showed possible improvements in quality of life, fatigue, and also mood, reduction in depression. And that's incredibly important because we know that the incidence of anxiety and depression in multiple sclerosis is about 50% across the lifespan. The gluten-free diet. So with this diet, there has not yet been shown a significant benefit in MS. There really haven't been any randomized controlled clinical trials. Currently, this diet is really recommended for people who've been diagnosed with celiac disease, which is another autoimmune disease. There are individuals who have gluten sensitivity as well, who don't have true celiac, but notice that they feel significantly worse when they have gluten. So this is another type of diet that could be considered. So what about vitamin D? If any of you have seen any of us in the room, you've probably had your vitamin D checked about 1 million times. Vitamin D is really important for your overall health. We know it's incredibly important for bone health, but for a long time it's believed to be kind of a holy grail in medicine to impact different chronic diseases as well as cancers. We know that in multiple sclerosis, low vitamin D significantly increases the risk of MS. And so for people who have multiple sclerosis, even though the risk to your family members is incredibly low of them developing MS, it is something that I always mention you should share with your children or your blood relatives, that they should have their vitamin D checked by their doctor, and if it's low, to supplement it, because we believe that higher vitamin D levels reduce that risk of development of MS. Studies on vitamin D once you actually have multiple sclerosis are conflicting. There are many studies that show if your vitamin D level is in a higher range, that you'll be less likely to have new lesions on MRI or new relapses. But there are other studies that show that it doesn't make a difference. And so because vitamin D is safe, supplementation is safe, and it has so many other great health impacts, it is currently recommended to get that vitamin D level into a good range in MS care. And you can see here that our bodies naturally make vitamin D when we're exposed to sunlight, but some of us, even though we may be out in the sun quite a bit, not necessarily in Ohio, but even people that in the summertime say I spend all day outside, we still can check that level and see that it can be incredibly low. So these are some other good sources of vitamin D that you see here on the slide that you can consider, but supplementation is also quite effective. So overall, does diet impact MS? I think we've answered that question, right? Yes, it does. So what is the best diet? I just ran through about 1 million different diets and probably left you incredibly confused as to what to do. Well, these are the standard recommendations in MS care. There is no definitive diet. So even though you may hear lots of advice from friends and family members that want to send you information because they care, there is no diet that you follow that is definitively going to change the outcome of MS. However, we talked about how diet can have a significant impact on your symptoms. If you are experiencing fatigue, considering a healthy diet where you're incorporating more fresh foods, fruits, vegetables, this could have a major impact. Or certainly if any of the diets that we discussed today, like the Mediterranean diet, if those are of interest to you, that would be something worth trying because it could help how you feel overall, and that's incredibly important when you're living with multiple sclerosis. The expert recommendations for diet in MS is to prepare foods at home as much as possible. Certainly it's fun to go out to eat, and that's wonderful, but as we know, we don't always know what they're putting in our food, and probably there's a lot of things that are in there that we might not want to eat because it's probably not the healthiest. We want to make sure we're getting enough colorful, fresh fruits and veggies. We want to eat some grains and try to focus on the whole grains as compared to the processed or refined grains. And then we really want to avoid processed foods and sugars as much as possible. So in conclusion, we know that healthy body weight is incredibly important for decreasing MS-associated disability. So if we think about it, if we're eating a poor diet and we're putting on extra weight, if we have problems with our mobility with MS, we're going to have a much harder time getting around, and we may damage our joints and lessen our mobility. We know that certainly diet and weight impacts cardiovascular disease. Colleen mentioned this in her talk about smoking. When we look at people who have high blood pressure or cholesterol problems or diabetes, those diseases actually result in faster progression of MS. So we're really trying to prevent those problems from occurring in the first place, or if you have them, to adequately treat them. And following a healthy diet is a really good way to minimize that risk. We also know that there's an increased risk of heart disease and stroke, and just because we have MS doesn't mean we couldn't have these other medical issues as well. We also talked about the gut microbiome. That's a major area of interest in MS, and we know it's closely tied to the immune system. So eating a healthy diet and minimizing processed foods will make that gut bacteria more friendly, more healthy overall, and so that's something we want to strive for. Also, we know that dietary supplements or metabolites like vitamins, fatty acids, amino acids have direct effects on the immune system and the brain. And then I just put this picture up here because there's so many people that contribute to the care of folks with MS at Ohio Health, and they're all amazing. Some of them are working today and can't be here. So just wanted to highlight that.